Good evening, everyone. Welcome to Community Conversations. I'm Dr. Wendy Guastafaro, Director of the School of Criminology and Criminal Justice. This school is housed within the College of Social Work and Criminal Justice at Florida Atlantic University. The community that is gathered here tonight is comprised of students, faculty, staff, administrators, special guests and friends of FAU, campus partners, and engaged community members. We are grateful that you have chosen to spend the next hour with us as we kick off our second year of these vital community conversations. Our college launched this series as a space to learn, discuss, and explore issues affecting our local communities, with a particular focus on where the professions of social work and criminal justice intersect. The College of Social Work and Criminal Justice is uniquely positioned to host these impactful conversations because of our mission. We are striving to build a more just, resilient, and equitable society. We are change makers and innovators serving the public good by working across our professions and within our communities. This is why we are here tonight. A few housekeeping notes. First, we do intend for this to be a conversation and we want to hear from you. Please post your comments in the chat box and we will respond to as many as possible during the Q&A. Just after you hear from our panelists and right before the Q&A begins, we will share a link to a quick survey in the chat. Please complete it. Your feedback is important to planning future events like this one. And finally, if you are a licensed mental health professional or nurse, thank you. And if you are earning a CEU credit for your attendance, we will need your survey response to generate your CEU certificate. You can expect to receive your certificate via email within 10 business days. Now, I will turn it over to Dr. Cassandra Atkin-Plunk.
3 years, 6 months, and 26 days ago, a gunman opened fire in our own backyard at Marjorie Stoneman-Douglas High School and killed 17 innocent people. This included 3 staff members and 14 students, 14 kids who had their whole lives ahead of them. This person also physically wounded 17 others while mentally and emotionally wounding countless others. Not even 1 year before that, and less than 200 miles north of us, a gunman walked into the Pulse Nightclub in Orlando and killed 49 innocent people. This person physically wounded another 53 individuals while also mentally and emotionally wounding countless others. Now, according to the Secret Service, in the 3 years spanning 2017 to 2019, 92 attackers committed 89 mass attacks in public spaces throughout the United States. And when we say mass attack or mass violence, we mean 3 or more people being harmed, not including the attacker. Now, unfortunately, in the majority of mass attacks, including the one at Marjorie Stoneman-Douglas High School, the attackers exhibited what are called pre-attack behaviors, or behaviors that elicited concern from other people, and where ultimately there were missed opportunities for intervention. So we're here tonight to talk about how Palm Beach County is seeking to reduce the likelihood of mass violence incidents taking place within our community, and how our local law enforcement is collaborating with behavioral health professionals to help ensure that people don't fall through the cracks. But what you'll learn tonight is that this takes all of us. Okay, we all need to learn about the warning signs. We all need to learn about what these pre-attack behaviors look like. And then if we see these behaviors in our family or in our friends or in our loved ones, we need to report it. So tonight, to talk about these steps being taken in Palm Beach County, we have Captain Randy Foley, Commander of the Behavioral Service Division at the Palm Beach County Sheriff's Office, Sandy Sisson, who is a unit manager in the Behavioral Services Division, as well as a licensed mental health counselor, Dr. Gena Rowlands, Senior Planner with the Palm Beach County Sheriff's Office, who is also a licensed clinical social worker, Dr. Vaughn Crichlow, Associate Professor in the FAU School of Criminology and Criminal Justice, and the Associate Dean for our college, and then Becky Walker, who holds an MSW and is the Chief Operating Officer for Southeast Florida Behavioral Health Network. All right, Captain Foley, take it away. but unmute yourself first.
Sorry about that. Thank you, Cassandra. And I'm glad to be welcomed here, and I'm glad to be participating in such an important topic that we have in today's community. As Cassandra said, my name is Randy Foley. I am a Capt with the Palm Beach County Sheriff's Office and the commander of the Behavioral Services Division. I've been with the Sheriff's Office 21 plus years. And the most common question I get since I am in charge of the Behavioral Services Division is, are you a social worker? The answer is no. I do not have a background in social work. I do hold a master's degree in criminal justice, but I do not have a social worker background at all. But I do have a diverse background to understand the needs on both sides of law enforcement and the social worker side. And being tasked with this new task force, I have learned a lot about how important it is for social workers and law enforcement to work together as a team to combat mass violence in today's community. So a little about myself. It's a little diverse, and it's led me to where I am now, and I'm very proud of my accomplishments, but I'm mostly proud of what we're doing with this team to change the way law enforcement is viewed and acts for years to come. So I am a United States Marine combat vet, SWAT for 16 years. I worked undercover narcotics, tactical team, and then I got promoted and I was moved into a different realm. So I kind of switched out of the tactical side and I started working the Special Victims Unit, which is sexual assaults, child abuse, and elderly abuse. From there, I was able to participate in the beginning stages of the Human Trafficking Task Force that Dr. Gena Rowlands and I were privy to start together, which is now a nationally recognized program to help those survivors in our communities that are victims and survivors of human trafficking, which really introduced me to how we can work together as a team. So in the Human Trafficking Task Force, we were using victim advocates and law enforcement working as a co-responder model for the last 7 years on the best ways to help these victims be identified and use a victim-centered and trauma-informed approach to investigations, which put our victims and survivors first and investigations second. So from there, as Cassandra said, we in 2018, we had the tragedy of Marjorie Stoneman-Douglas. Prior to that, in 2013, if you guys are not aware, Sheriff Bradshaw had the foresight of seeing that we needed to work better together with our community to help those that are in crisis and combat inappropriate actions with those who suffer from mental illness. So in 2013, he started the Behavioral Services Division, which focused on identifying those people in crisis in our community and preventing lethal encounters between law enforcement because of misunderstandings of behavior, which that went on for several years. And when we got into 2018, and with Stoneman-Douglas right in our backyard, we started to evolve a little bit. So from there, the sheriff had tasked me with working with the Behavioral Service Division and kind of come up with a intervention and prevention model for mass violence. So where we are now is we have a division that has about 30 people in it, and I'll go through the type of staff that we have in there. In that our goal and mission is to come in contact with those in crisis and suffer from mental illness in an attempt to intervene and prevent the mass violence, and then use clinical staff and therapists to help prevent them from coming back in contact with law enforcement. So we do not have, number one, those lethal encounters between law enforcement and those in crisis. And number two, we can prevent the community safety aspects of the mass violence that has been taking place across our nation. So our co-responder model pretty much consists of a law enforcement detective and a licensed clinical therapist that respond to referrals in our community that relate to threats to the community, not necessarily always threats to the individual who want to hurt themselves, but more threats focused on individuals that may want to hurt themselves and others in an attempt to prevent that act from happening, and then get them the assistance they need to not only become a more productive member of society, but get them to where they need to be, to where they're not coming back in law enforcement again, to where there's issues. So our division works about 900 cases a year with our protocols. That's 900 active cases a year of possible threats of community violence through the school board, through churches, through neighbors, through gang members, whatever comes across our desk. If it meets our criteria, we are 24/7 response unit where a clinician and a law enforcement officer will respond and see what we can do to diffuse that situation. De-escalation is a key part of what we do. We are not there in uniform. All of our detectives are plain clothes unless the situation dictates otherwise, and work closely alongside the clinicians to make sure that we are doing what's best, not only for the community, but for those who are suffering for crisis at that time. So we have, of those 30 people that work in our division, we have detectives. Their responsibilities consist of criminal investigations, search warrants, arrest warrants, and as most of you may or may not be aware of, are the red flag laws, which we call in the state of Florida risk protection orders, which allows law enforcement, with the permission of a judge, to obtain an individual's weapons, more specifically firearms, in order to protect not only themselves, but others in our community from harm until they can get to a place where they're no longer a threat to themselves and others. We have licensed clinical staff. They do clinical assessments and linking individuals with services, which Sandy and Becky will be addressing much further. So I'm not going to even address that side of the house because they can speak on it much more intelligently than I can. Case managers, which we have a couple different jobs for the case managers. We do have people that specialize in substance abuse, or SUDS, depending on how you're looking at it. Also, we have members of our team that work with juveniles in deferment programs to try to keep them out of the criminal justice system, to prevent them from going down the wrong path and getting good jobs and good futures. We have a full-time analyst that does all the workup for us to allow us to identify the best way to approach an individual and understand that what their past of being in crisis or mental illness is, as well as what their criminal past is, to come up with a plan to most safely approach someone without having to use force or lethal force at all. And lastly, the sheriff has done a really great job of understanding this is a big process. And we've been assigned a full-time legal advisor that assists us with developing our protocols, our guidelines, and assists us with red flag laws as far as adhering to what our investigations are. Additional responsibilities of the Behavioral Service Division include Crisis Intervention Team. Some of you may know that as the CIT teams. We, as a division, are responsible for instructing and training all law enforcement members in Palm Beach County, which also includes corrections and our dispatchers in all the agencies. So that has been quite a big task. Our goal is between 8 and 12 classes a year, which is quite an extensive goal, since we are, as you can see, we're working 900 cases a year, but they do a really great job of stepping up to the plate. We have a mixture of clinicians and educators and law enforcement teaching that class, so that it hits on all levels, so that people can get the ideas of what to look for and how to de-escalate situations, so we don't rise to the need for force or unnecessary law enforcement involvement. We are partnered on several levels with our community. On the law enforcement side, we are very close with the FBI, Homeland Security, Secret Service. We work with the Florida Department of Law Enforcement very closely, almost on a daily basis, the Palm Beach County School Board, and we have contacts and liaisons in all 40 municipalities in Palm Beach County. In addition to that, most of you may or may not know that Florida is broken up into 7 law enforcement regions. We have recently started a regional task force which governs Palm Beach County, Miami-Dade, Broward, and Monroe County. So basically Jupiter down to Key West. And we are now working as a joint task force between the 4 counties to combat what we have been doing in Palm Beach County since 2013. This was a endeavor from the Florida Department of Law Enforcement, and we've been tasked, and recently I've been identified as the chair for this program. And it's been a very interesting and fulfilling task, trying to get 4 counties to communicate effectively. So it's been a challenge, but I do see in the next couple of years this being a major contribution to helping our communities because we have these imaginary lines we call jurisdictions, but unfortunately the threats of our community don't stop those imaginary lines. In addition to that, we provide extensive amount of training to our law enforcement, not only at the sheriff's office, but countywide. And we have been recently asked to speak at the International Chiefs of Police Association, and I'll be in San Antonio next week presenting on this topic at the FBI National Conference, sharing what we're doing and looking for guidance on how we can improve our programs. So basically that's what we're doing in Palm Beach County on the law enforcement behavioral services side of the house. Excluding, I did not go in depth about the clinical side, because at this point I'm going to see this as a really great segue to turn this over to Sandy Sisson, who's been a huge assistance in me learning better ways to manage this program. So Sandy, please take it away.
Thank you, Captain Foley. Good evening. I am Sandy Sisson. By way of introduction, I obtained my master's degree in counselor education from Florida Atlantic University. I am a licensed mental health counselor and a qualified supervisor for mental health counseling in the state of Florida. I hold certifications for the treatment of addictions, anger management, and as well as trauma. I also have specialized training in threat assessments, in competency evaluations, in couples counseling, and in cognitive behavioral therapy. I was hired by the Sheriff's Office almost 7 years ago, initially as the first clinician for the threat assessment teams. For the past 3 years, I've served as a unit manager for behavioral services under Captain Foley. In addition to the case managers, I supervise a team of licensed clinical therapists who work alongside detectives to address and reduce threats in our community. Our therapists all have master's or doctoral degrees, and they are licensed under the Florida Department of Health as social workers, mental health counselors, or marriage and family therapists. And they too hold a variety of certifications and have different areas of expertise based on their training and their experience. And those range anywhere from work in the prison and jail systems to engaging children in play therapy. So it's a very wide range. Before I go into specifics of our work as a therapist, I always want to mention that the vast majority of individuals who have mental health conditions do not experience violent thoughts and they do not exhibit violent behaviors. Just as most people with a physical illness, those with a mental health condition manage those symptoms and they live their lives in a very functional way. It is a small percentage who pose a potential threat to our community and who meet the criteria for our division. So our goals, as Captain Foley has mentioned, is to immediately take steps to protect the community as well as the individual, and long-term to effect change by connecting these individuals with the appropriate mental health treatment so they can manage their emotions safely and live in a productive and healthy way. Captain Foley, before I get into how we work our cases, would you like to talk about our referral sources?
Oh, thanks, Sandy. I remember you mentioned that I should bring that up before. Thank you for reminding me. So most of our referral sources, believe it or not, come from law enforcement. We've done extensive education through our law enforcement community to have them identify when and when we should not be contacted and help them identify those that are in crisis or are suffering from mental illness rather than just being belligerent or negative towards law enforcement. So I think we're coming a long way. Law enforcement still has a long way to go, but I think with further education, you're going to see more referral services come in. But unfortunately, right now, about 75 to 80% of our referral sources are coming from law enforcement. Now, Dr. Crichlow is going to talk about it later. That is where the public outreach comes in, and I'm not going to steal any thunder from him because his presentation is amazing on this, is where we need the community to get more further involved. We're working very closely with our mental health providers in our community. Becky Walker's on board and we speak on a regular basis and we work very closely with them. But we really need the community to step up, and we'll address that further on. I'm sure you guys will have some questions about that. Sandy, did I cover that good enough?
Thank you, sir. So how we actually work a case is once our supervisory team accepts the case, it is assigned to a detective and a therapist. So the therapist's first responsibility is that when possible, they obtain mental health history and clinical information from families and other involved parties. We want to start to build a picture and also how to learn how to best approach this individual. So for example, those of you in the mental health field know that a clinician may use a different style to interact with someone who's diagnosed with a thought disorder, such as schizophrenia, as opposed to someone who's diagnosed with a mood disorder, such as a major depressive disorder. The next responsibility from there is to meet with this individual. So the location varies. It could be a mental health facility, it could be the jail or the home or a PBSO district if there are considerable risk factors in the homes. The clinician provides informed consent as soon as we meet with the individual, where we describe our role and discuss expectations with this individual. There is little clinical research about therapists being integrated with law enforcement. And so one of the things that we want to be especially careful about is to protect the rights of those individuals whom we serve. So that's always one of the big factors for us to make sure that the person understands and that they're willing to talk to us. So if the individual agrees, the clinician will then complete a clinical assessment. So we're evaluating for the level of risk and threat. Has the person demonstrated recent behavioral changes? Are there signs of harboring a grievance? When does the individual feel that violence is justified? Our team utilizes formal objective assessment tools. So we complete the VRIS-10, which is the violence risk screening for adults. We use the SAVERY, which is a structured assessment for violence risk in youth for those between the ages of 13 and 18. And we utilize the EARL, which is an early assessment risk list for children who are 12 years and younger. In addition to the risk and threat, we're also assessing for current therapeutic needs and obstacles to treatment. So what are the individual's current health issues, mental health issues? Are there symptoms of anxiety or trauma? Is the person being prescribed medications for a diagnosed mental health condition? Is the person not currently participating in services because they don't have access to transportation? So the purpose of the assessment is to gather objective information so we can make a determination of how to most effectively intervene in the pathway of violence. So upon completion of the assessment, the therapist then staffs the case with the rest of our clinical team, and we make a recommendation of the services that will most effectively meet the individual's needs as well as their motivation level. After further discussion with the referred person, our therapist will then link with these mental health and social services. So the linkage includes, but is not limited to, psychiatric services, counseling, case management, assistance with filing for disability, work assistance programs, etc. The level of care ranges from outpatient to residential. Our therapist will also facilitate the individual's engagement in services. So to give you an example, if an individual has a history of not being compliant with medications because of side effects, we may accompany them to their initial psychiatric appointment so we could advocate for solutions, and we can also teach them how to advocate or model for them how to advocate for themselves. Many of those with whom we work have no health insurance and they have limited financial resources. So our clinical team has established relationships with local agencies who have grant services or who charge in a sliding fee scale. In addition, Behavioral Services has partnered with the managing entity of Palm Beach County, Southeast Florida Behavioral Health Network, under a BJA grant to assist those seeking mental health as well as substance abuse services. This grant, which you'll hear more about as the panel continues, but it's been especially beneficial in providing access, faster access to services, more options of providers, and funding for the more expensive level of care, such as detox and inpatient treatment. So once our referred persons are connected with the appropriate providers, we will continue to communicate with that individual, with the family, with the provider, because we want to ensure that the mental health treatment needs are being met. We provide another layer of supportive reinforcement for the individual's well-being and by extension, the well-being of the community. And on that same note, a therapist also work with the entire family system because a functioning family can better support an at-risk individual. So we will connect family members to counseling services and local support groups for themselves. And if the family member needs an injunction for protection, we will link them with a domestic violence advocate who will assist them with the petition process. If the referred person is declining voluntary service and is at immediate risk, we will support family members to file an ex parte Baker Act in the court system so that the individual may be ordered for an involuntary assessment. We will also accompany family to the courthouse and guide them through the Marchman Act process, where a judge can order assessment, stabilization, and treatment for those who have a mental health, substance abuse problem. So that in a nutshell is the role of the clinicians. And I will now turn you over to Dr. Gena Rowlands, who will share more with you about her grant.
Hey, Gena, before you start, can I just add something to Sandy? In case some of you guys are wondering, as far as HIPAA and ethical guidelines go, we do adhere to those. So although we're doing a co-responder model, law enforcement and the licensed clinical therapist work closely together. Law enforcement will share all public information with the clinical therapist to help them with their assessment, but the clinical therapist will not share any information back to law enforcement. It's completely separate. So we do respect the privacy laws, the ethical guidelines of their licensor, as well as HIPAA guidelines.
Thank you for mentioning that. So another major aspect of my responsibilities has been to design our approach to our cases and our protocols so that we can ensure that we're meeting our legal and ethical guidelines. As I mentioned earlier, there is little research about therapists being integrated with law enforcement, but we do want to ensure that while we're safeguarding the community, that we are not violating someone's rights, because obviously we work for a law enforcement agency.
Great. Hi, everyone. Thank you so much for having us this evening. We are super excited to be here discussing this really important topic. I am Dr. Gena Rowlands, a senior planner with the Palm Beach County Sheriff's Office, where I have worked for the past 18 years. My primary responsibility at the Sheriff's Office is identifying and acquiring alternative funding, namely federal grants to support projects which are not funded through general revenue dollars. My background is actually in social work. My doctorate is in social work. I'm a licensed clinical social worker, a certified addiction professional, and also a certified clinical trauma professional. In fact, several of the grant-funded projects for which I have been responsible over the years and currently have what I called a social worky component, addressing complex community issues, including community violence, human trafficking, victim services, and community reentry. The reality is there is an inextricable link between criminal justice and social work, but then I know I am preaching to the choir here. In early 2018, after the tragedy at Marjory Stoneman, we began exploring ways in which we could fortify our efforts to prevent mass violence in our community. We identified funding through DOJ's Justice and Mental Health Collaboration Program. We were awarded funding in late 2018. And funding has supported enhanced collaboration among community stakeholders, enhanced behavioral health services, for which you've heard about from Ms. Sisson as well as Captain Foley, and also a robust community awareness campaign, which Dr. Vaughn Crichlow is going to share with you. I don't want to be redundant and talk more about what you've already heard about. They've done a terrific job explaining the services through the Behavioral Services Division, and Dr. Crichlow is going to talk to you about our robust campaign, but I'd be happy to answer any questions at the end if you have any more specific questions about the grant itself. Thank you. And now to Dr. Vaughn Crichlow, who's going to tell us all about our awareness campaign.
Thank you, Dr. Rowlands. If you can hear me, just give me a thumbs up. All right. I am Vaughn Crichlow, and I'm the Associate Dean of the College of Social Work and Criminal Justice, an amazing college in our second year now. I'm also an associate professor in the School of Criminology and Criminal Justice. And how would I describe myself and my role? Well, I guess I was one of those kids that didn't know what they wanted to do when they grew up. And maybe as an adult, I didn't know what I wanted to do. I actually have 4 degrees. My first degree was way back when at the University of the West Indies on an island called Trinidad. That's where I majored in English. I was an English major and I read a lot of books. And I also had a keen interest in law and justice. And so I journeyed through academia. I actually completed a law degree at the University of London. And well, I took a different path and found myself in a place called United States of America, studying towards a degree in criminal justice, and I moved towards criminal justice research. And I really believe that my identity as a researcher was greatly shaped by experiences in the city of Detroit, where I conducted extensive work in the community on violence prevention projects, working with business owners, as well as what we call pulling levers types of projects, where we identify at-risk individuals in the community and bring them into call-ins to talk about, they used to refer to those as come to Jesus moments, and find ways in which we can identify the biggest influencers in the community when it comes to criminal activity and get them to turn from their ways, give them a chance to connect to services and listen to testimonials from parents who have lost loved ones, listen to coaches and leaders within their communities, listen to social service providers about all of the opportunities that they would have to come out of the path, or to take a different path when it comes to improving themselves and changing the trajectory of their lives. I really believed in that project. And this work, I believe, really transformed me. And here I am at Florida Atlantic University. I have a doctorate in criminal justice, and I conduct research principally in the area of police-community relations. And I'm quite fortunate, I believe, to have found these individuals who are on this call here and to work with them as colleagues side by side on, I think, one of the most important initiatives in our time when it comes to preventing mass violence. Dr. Atkin-Plunk and myself, we are evaluators on the grant that Dr. Rowlands has just referred to. And this is a unique project that allows us to be embedded in the process in terms of the planning, the strategic planning, as well as the implementation and rollout that would allow us to evaluate the BSD and the work of the therapist to determine whether or not we are making a difference in the lives of these individuals who are being diverted to and provided with access to care. There is a huge national debate right now. It's been going on for some time regarding justice and responsiveness to concerns in the community, as well as issues pertaining to race, particularly anti-Black racism. And in the aftermath of George Floyd's death or murder, there's been a lot of heated discussion about the role of police, about the role of police, particularly when it comes to engaging with the community, encounters with the community, and whether or not a justice response should be a law enforcement response. We have found, research has shown us that we need police. Surprise, surprise, that there is a role for law enforcement. We have also found that there is a role for social workers, mental health counselors, and that there are a range of problems that are within communities that did not originate with law enforcement. While law enforcement might have issues that need to be resolved, there are also issues within the community that a multi-agency type of platform or collaborative initiative can help to address those issues in the community. So when we talk about mass violence and preventing mass violence, and this aspect of the project, this major portion of the project, which is aware and care, what we're saying to the community is that you can prevent mass violence. And I believe that this is a message of hope. It's also a message that has some action points to it, that we can do something about this. You can be the difference, and it starts with you. And so it's a major component of this, the research or the grant side of the project, which was to conduct the public awareness campaign. And we, instead of reinventing the wheel, we partnered with the task force assembled under the auspices of the Criminal Justice Commission, so PBSO and Southeast Florida Behavioral Health Network. We've partnered with the members of the task force, and together, collaboratively, we've come up with the Aware and Care campaign, which is actually mandated as part of the grant. And so I think that it's really a testimony of being able to work together, which I think is really needed, not just in Palm Beach County, but even across the state of Florida and indeed across the country. And so the Community Awareness Subcommittee, along with the JMHCP team, we worked to advance the public awareness campaign. And last year, began working with a graphic designer, which many of us know quite well, to develop the brand of the Aware and Care public awareness campaign. And we were able to really develop this brand. And campaign materials were created, and you will see some of these displayed in the coming weeks and months on billboards, on public transportation and bus shelters within the county. And so 4 billboards were secured, and these are located in Eastern Palm Beach County. And correct me if I'm wrong, Cassandra, some of the billboards are up already? That's right. And so you see them close to the 95 and in different parts of the county, as well as we received news that 3 PalmTran buses, we've secured them with a wrap with the Aware and Care campaign artwork across those buses. And let me tell you something about PalmTran. It's a public transit bus system, right, that has 32 routes, and it connects all areas of the county with almost 3,000 stops, with a daily ridership of in the vicinity of 35,000. We also have bus shelters. We're going to have 30 bus shelters throughout the county, which will display the Aware and Care posters. And there are some other things as well, which we can talk later about, such as a promotional magnet. There are other aspects to the campaign. There's going to be a social media element, because a lot of us are on social media. We live our lives there. And so you want to reach the community, you have to go to where they are, as well as in schools, in terms of things that we can present or package for our students, because this is a very important component to the awareness piece. Students are influenced, affected, and often victims of mass violence in some way, right? And so that's an overview of the Aware and Care campaign. Let me just talk for a few minutes about the warning signs and concerning behaviors. Now, to be clear, we're not saying that the warning signs are indicators that mass violence is about to happen. That might not necessarily be the case. But as the research has shown us, as well as the FBI's behavioral analysis, they had a publication on mass violence in America. They looked at causes, impacts, and solutions. We found that there were a number of factors that were common across many of these incidents. And guess what? They all could have been prevented. They all could have been prevented. And so in providing the care, a crucial piece to this is being able to identify. How can we provide care before we identify? We need to be able to identify some of these indicators. And so if you look at the website, which a link will be provided to you later on, you will see that the warning signs are there for the public to see. This website that the team has developed allows the public to see what we call the red zone, or the pre-attack behaviors that may indicate an imminent threat, such as a dramatic change in appearance, abrupt and unexplained use of drugs, medications, stockpiling of weapons, ammunition, pre-attack staging. These types of behaviors are signs that something is about to go down, right? And there's also information on there in terms of who to call, where to go to, okay? That's extremely important. But you know, another part of this that I'm extremely proud of is that it's not just about the imminent threat. It's not just about crisis response. It's also about the low to medium risk individuals within our community. And the thing about it is that, you know, if we're successful in this, then, you know, we're not going to be able to fully measure and understand how much mass violence has been prevented. And not just that, but how many families have been enhanced and helped in various ways. And that's a good thing, right? And so some of those pre-attack ideations and behaviors, which might be manifested in low to medium risk individuals, would be homicidal ideations, fantasies about hurting others, increased interest in past attacks or attackers. There's also some common themes such as harboring of grievances, a deep sense of injustice. A person might feel personally victimized by bullying, persecuted, injured by others, and there are different behaviors that are manifested as a result of that. One might appear to be in a downward spiral, okay? As well as recent and chronic stressors. And you know, these stressors affect us all, right? Major personal loss of stabilizing family member. This is particularly evident with our children, okay? Financial, job-related, marital problems, abuse of drugs, alcohol, etc. Okay, and I know that many of the experts on this call who deal with these individuals on an individual basis can really speak to some of the needs, as well as how to access the services that are needed. There are also behavioral and emotional indicators. And so all of these are extremely important. To conclude, I also want to highlight the fact that there's another link in this chain that we are aware of. This is not a be all and end all, right? This is a start. And I believe we're headed down the right path. But you know, what goes on within the schools is of deep concern to all of the experts on this call, as well as many of the practitioners we work with on the task force. And a colleague of mine who I believe is out there in the audience, Dr. Alan Barsky, who he's actually a professor in the School of Social Work. He recently published an article with Dre Johnson, who is a social worker working in Broward County Schools. And their article is entitled Preventing Gun Violence in Schools, Roles and Perspectives of Social Workers. This is a great article. And I believe that you know, it reflects a growing body of literature out there about the types of services that are provided in the schools. A lot of this work is currently going on in Palm Beach County. It's just not heralded, it's not out there in the news, but this work is extremely important. And I believe that these therapists, these social workers and counselors who are working in the schools, who are developing general strategies, as well as focus strategies for individual kids, need to be supported. Some of them need more resources, and we need to work through how to communicate information that might be confidential, when to communicate, who to communicate with, how to ensure that we're following FERPA rules. So all of these are important issues, and I really believe that there is clearly something for all of us as stakeholders to address as we continue this work. That it's important to increase awareness. It's important to provide access to care and to let people know that there is hope, but it's also important to embed ourselves within the community. And I believe that that's the next step in terms of the work of the task force and even beyond the grant. And so when it comes to accessing services, we have Becky Walker, and she'll be able to walk you through some of the services available to people in the community. Becky?
Thank you, Vaughn. My name is Becky Walker, and I am the Chief Operating Officer at Southeast Florida Behavioral Health Network. Tell you a little bit about my background. I had a degree in social work, a bachelor's degree in social work from Florida State University, and a master's degree in social work from Florida International University. And unlike you, Vaughn, I knew from the time I was maybe 10, 12 years old that this is what I wanted to do. Some people think it's because I read too much Charles Dickens as a child, but I've always felt like the need to make a difference in the community, and so I embarked on a social work career. It's lasted now 45 years. Just saying that kind of makes me a little tired, but I started my career in child welfare 25 years, and I did spend a little bit of time at Florida Atlantic University I worked there for a while regularly, but also as an adjunct professor for like about 18 years. And I have worked with the Palm Beach County Criminal Justice Commission too. And that's probably where Dr. Rowlands and I first started collaborating on different grants and ways to work together with law enforcement. My minor and my bachelor's degree was actually in criminology. So I saw the nexus of the two from kind of the beginning of my academic career. And so being able to take that and work in the community and make changes, whether it's at an individual level as a therapist, which really wasn't the thing that I wanted to pursue. I wanted to look at the broader issues, and a lot of what I taught at FAU was in macro practice and how we work in the community. And I think this project that the grant that we're working on here is a great example of that. So after I left the Criminal Justice Commission, I went to work almost 8 years ago now for Southeast Florida Behavioral Health Network. And I really, as a social worker, and I've actually hired some of my former students that now work for us at Southeast Florida, and I see them everywhere I go throughout the behavioral health system. But it's really been it's very, heartening to me to see people embrace the career and really want to make a difference, because, social workers have a chance every day to make a difference in someone's lives. So it's so I went to Southeast Florida and saw this opportunity to work with the sheriff's office on this grant, and it fits in with the mission of Southeast Florida Behavioral Health Network. So I don't know, I think that's enough about me. 45 years, and I did a lot of stuff, and we've worked together a lot. I think being able to work not only as in an organization and try to make changes there for things to work better, but to be able to go outside the organization and be in your community and be embedded and be able to get out in front of the issues, like the campaign that as we have going on as part of this project, is really where we want to be. My goal would be that the sheriff's office never sees these people, that they don't have to identify them, that they get identified earlier and get the assistance they need to stay out of any kind of system, whether it's the juvenile justice system or the criminal justice system. I would hope that we would be able to intercept them at an earlier point. So Southeast Florida Behavioral Health Network is a network of about 41 providers. Kind of changes every day. Right now, we're going through our budget and trying to figure out where we can expand. our opportunities. And we cover 5 counties: Palm Beach, Martin, St. Lucie, Indian River, and Okeechobee counties. So we get our primary source of funding is the Department of Children and Families, and most of that funding comes through the federal block grant. So we take that funding that we receive and we contract with agencies to provide services. And we, what we do is look for where are the needs in the community? What are the kinds of services that are needed? We fund prevention programs that are in the schools and in the community. We fund outpatient programs, crisis stabilization for people that have been Baker acted. We fund all the way a whole host of levels of care, and our goal is really to assess the person, get them into the appropriate level of care, provide them with that appropriate services, and be able to, if they're not in the community, if they're in one of our residential programs, reintegrate them into the community. We also have a part of what we do to work with people that are coming out of jails and prisons. We have worked to develop a recovery-oriented system of care. And that is exactly what it sounds like, that we have to believe in people's recovery. We have to give them voices and choices in their treatment, and that we can work together to provide those services that people need. We have it's about 27 of our 41 providers are in Palm Beach County. Again, that's a moving target. We spend, if you look at our budget, which is around $75 million, and that's about, let's say 2/3, 1/3 is 2/3 for Palm Beach County and 1/3 for our 4 northern counties. And what we spend the most on is adult mental health services. And that it might surprise a lot of people because you think about children and the need for children, but children generally come with some kind of a funding source. So that's where the bulk of our funding is spent. We have received a lot of federal grants for substance use disorder treatment. So we have a variety of that, all the way from detoxification, outpatient, residential programs, specialized programs for pregnant women or women and babies. So we work with it, but what we try to do every year is look at where are the gaps and where can we fill them in. And we're always looking for other opportunities like this grant, or how can we partner with someone else to provide better services and get more embedded in the community. So that's why we participate on the task force, and we participate in the campaigns, and we try to use our own website, which is sefbhn.org, that has a list of all of our services, and try to make sure that we get the word out and that people access. We have one of our biggest programs is we have a mobile response team. They work hand in hand with the Behavioral Services Division, but they also are contacted by law enforcement, by schools, by parents, by individuals, anyone seeking that assistance for a behavioral health issue, whether it's substance use or a mental health issue, and contact 211. They will connect them to the closest mobile response team, and they respond 24/7, 365 within 60 minutes. So, and it is really a critical part of what we do and really connects with this grant. And to have the opportunity, what we have at our office is one person funded by the grant, a care coordinator, and her job is if Sandy's people aren't quite sure what is the best service or have trouble accessing it, our job is to bust down those barriers and get the people into the appropriate level of service that they need and expedite it so that we ensure the safety of the community, but also getting people the help that they need as soon as we possibly can. So if you want to, I encourage you to go to our website, learn more about us, and we are very pleased to be partners in this grant with everyone. And we've worked with Palm Beach Sheriff's Office over several grants over the years, and I think it's really been a good partnership. And this group that we have and this grant is working really well. And I think that you will see, especially with the new campaign starting, the opportunity to kind of get ahead of the curve in this process. So back to you, Cassandra.
Thank you to all of our amazing panelists. Just hearing what is happening in our community that the community doesn't typically know about or see. So before we get into the Q&A, I really want to reiterate some things that were said, and that being that we know that mass violence incidents can be prevented if people are able to recognize the warning signs that Dr. Crichlow discussed. But more important to that is that people aren't afraid to reach out and people aren't afraid to report. And it can be hard to do what's right. And it can be hard to report on somebody, especially if it's a loved one, or if it's a friend, or if it's a fellow student, or a colleague. And that's hard. But I promise you, it is a lot easier to report than it is to have a tragedy occur and to know that you could have done something to prevent it. Dr. Barsky, who is one of our social work faculty, sent me a link, and I'm going to put it in the chat, that just today, the Lee County Sheriff, which I believe is Fort Myers. Oh, good, got it right. That they announced that they may have prevented a mass school shooting by students because a student had the courage to let a teacher know about their plans. And that's just today. And, so how can we help others in our community know what to do to prevent mass violence? Share, and Catherine is going to put the website in the chat box right now. But this is the website that Dr. Crichlow was discussing, the Aware and Care campaign that was created in an effort to get this information out to our community. We want everybody to know and to be able to recognize the warning signs. As Sandy said, not everybody who has a mental health concern or mental health issue is going to go on to commit an act of violence. That is just not the case at all. But it's when we start seeing a compilation of these warning signs or these risk factors start to build on each other, when you see a sudden change in somebody's behavior, that it might be the time to reach out to somebody. Reach out to law enforcement, reach out to the Behavioral Services Division, reach out to somebody so that we don't have one of these incidents within our community. So we've received a lot of questions, a couple of questions. One thing I want to say really quick is I had a technical issue. And so if you sent any questions, if you could please send them again to me so that I make sure that we answer all of them. I tried to compile most of them in a Word document as they were coming in. But please feel free to ask additional questions to resend those. But one more thing before we get into the Q&A, we're going to ask you to complete a brief survey. It's really important for our informational purposes for you to complete this. The link is also being added to the chat right now. It just takes a minute. So please go ahead and fill that out. one of the first questions, and I will, basically somebody asked, is there a specific age group that stands out? And I assume that, the question is related to people who are engaging in incidents of mass violence. I have something to say, but I will let our panelists answer first.
Sandy, you want to tack that one, or you want me to, for lack of a better term?
I can briefly touch on it, but I think we probably see the highest percentage are adults. Unfortunately, though, as time has gone by, we've seen a lot more social media threats by those who are younger, evidenced by the fact that, we're using the EARL, which is an assessment tool for children who are, 12 years and younger. So we're seeing more of that. But I'd say that, the highest percentage that we see are adults.
And so, Captain Foley, were you going to add to that?
No, I absolutely agree with Sandy. We are seeing it's diverse. I'd say the largest number is definitely adults that we're having problems with. Unfortunately, we are seeing an increase in the juveniles as far as community threats or indicators of community threats. And
so one of the important things to know is that that's what we're seeing here in Palm Beach County. It's going to be different in other jurisdictions. The United States Secret Service, what I mentioned earlier, between 2019 or 2017 and 2019, the 80 plus number of attacks. The Secret Service has the National Threat Assessment Center, and I would highly recommend that you look into the National Threat Assessment Center. You can Google that. But in that report, in 2019, of the 37 attackers who carried out mass attacks in public spaces just in 2019, across the United States, 68% of those attackers were under the age of 25. So, what we're seeing in Palm Beach County is not necessarily what's representative of the United States. What we're seeing, what the National Threat Assessment Center is saying, again, that's a broad picture of the entire United States. So another question that came in is, when reporting suspicious behavior, is it anonymous?
All right, I guess I'll address that one. So that is a possibility. Now, understand, with law enforcement, there are Florida public record laws. If there is a law enforcement report completed, it is subject to public record. You can make anonymous complaints through law enforcement, and depending on the situation, we will work with that individual as much as possible. We much rather find a way to work with you than you not call. The important thing is that you do reach out. I really want to point out, though, that we are starting to see, as a culture, law enforcement change. The training is out there. It's not just we're out there to go there, we're going to take you immediately to jail. There are other ways of handling things, and the sheriff's office and our local communities, the school board, we're all working together as a team to figure out the best ways to do this. So, as Cassandra said, we really encourage you to make that call, because it's more important that you make that call than you don't, because we don't want innocent lives, where we can have Becky and Sandy's teams really make a difference in someone's life to help them get where they need to be and keep them out of law enforcement's path, rather than not call it all and force them into law enforcement's path. So I can't promise you that it's always going to be anonymous on the law enforcement side, but we'll do what we can. Sandy, anything on your side, or Becky? I know NAMI has a good program that works really well with the community. It's a really good organization out there, and we work closely with them also. So I think that's another alternative. And the important thing is go somewhere. Just don't keep it to yourself.
I just want to emphasize the point as well that as far as the Aware and Care website goes, that folks don't only have the option of calling 911, as important as that is, there's also the 211 option. And so the whole point is to encourage people to report, and some may feel that approaching law enforcement might not be the thing that they want to do. And the site does provide some guidance as to the types of issues that could be addressed with a call to 211 to speak directly to a counselor. And they are trained over there to handle these types of issues. I don't know if anyone else on the panel would like to talk about 211.
Well, as far as 211 goes, we work very closely with them. They've been a partner with us from the beginning with this. They're on the CJC board. Dr. Gena Rowlands knows them very well, as she's introduced me to them. They do a really great job of providing guidances and service when needed outside of law enforcement. As Dr. Crichlow stated, that on the Aware and Care website, it gives you the option, if this is immediate concern to safety, press the button for 911. If it's to get information and guidance and resources in the community, press 211. So there are options to identify where you are, and it's a pretty simple website to use. I definitely encourage everyone looking into it and sharing it with your friends and family.
And I would like to add to that, we work very closely with them to make sure, I think, over a long history, there have been some times that people thought 211 didn't keep up to date, but we make sure we work with them. We do fund them on a number of different projects, so that the one here in our area is they are ready at all times to make sure that people get link to the proper resources. And if they call and want the mobile response team, that is what we call a warm handoff. They have to make sure that that person is connected to a mobile response team, they are connected to the proper providers, and we keep them up to that. They're also their suicide prevention hotline, and a number, we're working with them on expanding some of those options right now. So they're a critical resource to the community. And I too encourage everyone to use that.
Thank you. So another question that just came in was, what would you tell someone who is afraid to report on their loved one because of what they fear might happen to their loved one?
Sandy, you look like you have a good answer for this one.
I can figure how to get my mute off. I think a good way of responding to that is, what would happen if you didn't? So, what we have been seeing more and more of, now that I've been doing this for 7 years, a lot of family members with whom we've worked previously with their loved ones will call us and say, hey, listen, you've worked with my brother, my sister, my son 6 years ago, and he's now gotten off his meds, and he's going down that path again. So I think that the important thing is to keep the conversation going, because as we build little by little in our community, that now we have people who are willing to reach out to a law enforcement agency to say, hey, listen, these issues are coming up, can you guys help? That we've got to also make it comfortable for those people to reach out and to know that we're actually going to handle it in a compassionate way. And there are two sides to it, because obviously there's the community safety side, but also on the individual level, to know that someone actually cares And I will tell you, 7 years ago, when I started to go out on cases, my initial thought was, no one will speak with me. I'm here with, law enforcement. And it's amazing how many people in our community need someone that they can talk to, and how quickly they understand and they're willing to talk with someone who's interested. So, I mean, I would tell, a family member, once again, what would happen if you didn't, and that at some point you have to trust that the system will handle this before your loved one has done something that's seriously wrong and seriously hurt and injure others.
I think that is a fantastic response, Sandy. So we have time for just one more question. So try to figure out which question to ask. Have there been any attempts of mass violence in Palm Beach County that have been stopped?
Captain.
The quick answer is yes. And I've sat down with Dr. Cassandra Eckenplunk and Crichlow, and we've discussed the generalities of what we've seen that we've stopped possible acts of violence from occurring. Is it a tangible way? Can we find a tangible number of what we've stopped? No. There are cases that we have identified that we have stopped acts of violence from moving forward, and we have successfully linked most of them with clinicians for a positive outcome. Unfortunately, a lot of those cases are still in an open status, so I can't speak with them in detail. But yes, bluntly, yes, we have stopped several cases of mass violence in Palm Beach County, and I have very close contact with the local communities as far as other counties, Miami-Dade and Broward, and they're seeing the same successes. Unfortunately, on the big picture, it's not tangible, but even if we've stopped 5 or 6, and don't quote me on that number, we do know we are making a difference, and with your help, we can make a bigger difference.
Thank you, Captain. So one last quick question. Somebody asked if you guys would be willing to share your contact information. I'm not going to answer the question yes. So if you are willing to share your contact information, if you don't mind sharing it in the chat to everyone. But we are about out of time. And we, again, would really like to thank our fantastic panelists, Captain Foley, Sandy, Becky, Dr. Rowlands, Dr. Crichlow. We really, again, appreciate all of the seen and really more of the unseen work that you do for our communities and for the work that you're collectively doing to prevent future acts of mass violence within Palm Beach County. To attendees, please mark your calendars and plan to join us for our next Community Conversations event, which will be held on November 9th. And we will be discussing the Marchman Act and the purpose that it serves for families that are struggling with substance misuse. So thank you again for joining us this evening, and have a great rest of your night.